top news, the host of your favorite show, Top Health. In today's program, we would be meeting Dr. A.S. Dugal, Medical Officer, CHC Adhampur, and we would be discussing on the topic diabetes. Dr. Dugal, first of all, I welcome you in the studio.
Thank you.
My first question to you is, what is diabetes?
Look, diabetes is a disease in which the human body, fails to control the sugar levels in the body. So
Right.
when the sugar levels are uncontrolled, they create so many problems.
Yes.
Problems like they can create problems with the heart, kidney, eyes, brain. So it is just the inability of the body to control the sugar.
Right. So what are the causes for this diabetes?
Look, this problem of diabetes is increasing day by day. Many-fold, I tell you. If we go by the statistics,
Yes.
we'll see that after every 4 persons, 1 person is suffering from this diabetes.
Yes.
Not only in India, it's global.
Alright.
Globally, this problem has increased so much. So causes, I tell you one thing. Causes are so many, but I would like to put forward some main causes.
Right.
One is genetics.
Okay.
Like parents are having this disease, so their children are likely, not I tell 100%, but they're likely to have this disease
Right.
at some age or. And secondly, our lifestyle, which is changing very rapidly.
Yes.
That we are eating, without some proper, way.
Yes.
Like we are leading more sedentary life. We
Yes.
are, going less physical exercise.
Yes.
So all these things, they are contributing to this increasing level of diabetes.
Right. So if somebody is having diabetes, so how does that person come to know that he is suffering from diabetes?
Right. So very good question, because when the patient reaches the doctor, the
Yes.
problem itself has started a long time back.
Right.
So the main features from where a person should keep in mind that he is having diabetes, like the patient is having increased thirst. He
Right.
wants to drink more of water.
Okay.
His appetite increases. Like
Right.
he wants to have more food.
Right.
He passes more of urine.
Right.
He eats normally, but then his weight is losing.
Right.
Right?
Okay.
The person is normal. Person is having his normal meals, normal. Everything is normal, but the weight goes on decreasing.
Okay.
Secondly, thirdly, like if there is a small wound, which likely heals in a day or so.
Right.
But in the patients which are suspected to having diabetes, these wounds, these infections, they get delayed.
Okay.
The person, the normal person, which a wound heals in say about 2 to 3 days.
Mhm.
In a diabetic person, the wound may take weeks to heal.
All right.
So these are some of the clinical features from where a person can imagine that he can have diabetes, and so that I feel he should consult a doctor then.
Okay. Once the diabetes is detected,
Right.
what kind of treatments one should go, or change in diet plans or medicines? What is the best way to?
When a person approaches us with these symptoms,
Yes.
the person comes to our clinic, we confirm the diagnosis by doing some tests. There are some like blood tests from where we confirm that the person is now having diabetes.
Yes.
Right?
Okay.
Then when the diagnosis is confirmed, then we try to see how the patient is going to be treated. Like
Okay.
first of all, we always tell the patient that some lifestyle modifications should be there. Lifestyle modifications, like we always tell them to lose some weight.
Right.
Change his eating habits,
Right.
do some physical exercise.
Okay.
These are the lifestyle modifications.
Okay.
Like,
So we often see when a patient has to take medicine for a longer time, he tends to skip or forget the medicine. What are the implications of not taking medicine well in time?
Very right, you are. But then there are some diseases in which we have to take medicine for maybe lifelong.
Right.
If we won't take, I tell you, there are so many complications. So like today we are talking about diabetes.
Yes.
If a patient is not following the advice of a doctor and is not taking the medicines,
Yes.
I tell you, so many complications can occur. the patient's eyes can be affected,
Okay.
the patient's kidneys can be affected,
Oh.
his heart can be affected, his
Okay.
brain can be affected,
Ah.
his nerves can be affected.
Mhm.
So what I mean to say is, following the advice of the doctor and just taking the medicine, he can continue to live a normal life. But
Right.
when the patient tries to skip medicine or tries to do what comes in his or her mind, then these complications do occur.
Okay, sir. Like, sir, we spoke about the complications.
Right.
If a complication do happen, what are the remedies for them?
Look, remedies are always there, but I would just like to tell my the viewers that prevention is always better than cure.
Exactly.
But okay, some things have gone wrong and the complications have come. But then complications can be controlled.
Right.
If a diabetic patient gets his eyes examined once in a year,
Right.
gets his kidneys examined once in a year, gets his heart examined once in a year,
Okay.
gets his all the nerve tests and all the cholesterol levels. But if he follows again, if he follows the advice of the doctor and goes by the doctor's advice and medications, much of the complications can be controlled and covered, and the person can lead a normal life.
So, Dr. A.S. Dugal, today you have come in our studio. I would like to thank you for that.
Even I would like to thank that you have called me to discuss such an important topic.
Thank you very much, sir. So this was Dr. A.S. Dugal, Medical Officer, CHC Adhampur. He has given us valuable information on diabetes. So in the next episode, I would be introducing you to another doctor on another health issue. So till then, do wait for a next episode.